Thank you, operator, and thank you to everybody for joining us for the COVID-19 daily media call for April 27th. Governor Walz is not joining us for today's call. Today's agenda will start with an update on the COVID-19 outbreak from Minnesota Commissioner of Health, Jan Malcolm. Following that brief update, we'll focus on a topic that's gotten a lot of attention in recent days, that is the impacts of COVID-19 on our food processing sector and the efforts underway to help address those concerns. We'll be hearing brief updates on that topic from MDH Infectious Disease Director KRISTEN, Minnesota Agriculture Commissioner Tom Peterson, and Minnesota Department of Labor and Industry Commissioner Nancy Leppink. Following that, we will open it up for reporter questions. So with that, I will now turn it over to Commissioner Malcolm.
Thank you, Mike, and good afternoon, everyone. I'll do the quick data update as usual. Globally, as of early this morning, the world was fast approaching 3 million total deaths. That was an increase of about 100,000 from the prior day, and just under 207,000, it was just under 3 million cases and just under 207,000 deaths. The case total increased about 100,000 and the mortality by 10,000 globally. In the United States, this morning, the U.S. was just under 1 million cases, fast approaching 1 million, increase of about 60,000 over the day prior, and almost 55,000 deaths, an increase of 3,000 from the day prior. Here in Minnesota, today we are at a total of 3,816 total laboratory confirmed cases, an increase of 215 from yesterday. This reflects a significant number of cases from southwest Minnesota, which we will be talking about later in the call. The new total of mortality, of deaths from COVID-19 is now 286, up 14 from Sunday's count, of Saturday data. 12 of these 14 deaths, again, occurred in residents of long-term care facilities, continuing that pattern that we've been seeing pretty consistently throughout the progression of the epidemic in Minnesota. This most recent set of 14 deaths includes 11 people in Hennepin County, 2 in Ramsey, and 1 in Winona. Demographically, this total includes 6 persons in their 90s, 1 in their 80s, 3 in their 70s, 3 in their 60s, and 1 individual in their 50s who was also a long-term care resident. As of today, 1,842 patients have been released from isolation, and there are 292 patients currently in the hospital, 122 of those in intensive care. So we have seen a fairly slow but steady increase in the number of intensive care cases, but a lower percentage of the total hospitalization now in intensive care than we had seen a couple of weeks ago. With that, I'm going to pass it to KRISTEN to kind of shift into a more focused discussion on food processing plants, which have been much in the news around the country as well as here in Minnesota. So I'll turn it over to you, Chris.
Thank you, Commissioner. I just want to give you a little bit of an overview of the work that the department has been doing as it relates to processing plants. We began a proactive outreach to large meat processing and agribusiness facilities following the situation with the Smithfield processing plant in South Dakota, and provided some guidance to these facilities, talked through, considerations for distancing of employees, employee screening, just started a conversation with them about some of the things that they should be thinking about. And as you're aware, just over the last week and a half, we started to see situations evolving in Minnesota. In the case of JBS, we identified a cluster of cases who had the commonality of working at the plant, and we worked with local public health, with the local health care in the community to discuss the response to that situation. An MDH team visited the plant to evaluate their distancing for employees and provide guidance that they could consider for improving how they were doing things, including more aggressive employee screening and exclusion. Ultimately, given the number of cases identified, from workers at this plant, and expansive testing for employees was stood up. This testing was conducted by the local Sanford Health, and this process, again, was a joint effort between the local health care, local public health, with some assistance from the Department of Health. Local public health has had a role in outreach, ensuring that essential services and housing can be provided, and helping to coordinate between the state public health as well as in health care. As you're aware, there are multiple such facilities across the state, and so MDH has stood up an active response for dealing with increase in cases of COVID from agricultural production plants. In many of the cases, local public health takes the lead in responding to reports of symptomatic employees from these sites. They will work in conjunction with their local healthcare system to ensure that, again, symptomatic employees can be tested. We at MDH serve as a resource to them, providing subject matter expertise and guidance as needed. And we help provide guidance for the employer on the importance of aggressive employee screening and other guidelines. The role that the Department of Health serves is providing guidelines and recommendations. We do not have a regulatory role for these plants. And in addition to that, we have also continued to do outreach. And so last week, we did a call with vegetable canning plants to talk with them about some of the things that they should be considering as they anticipate ramping up their work as the summer season comes upon us. And with that, I will turn it over to Commissioner Peterson.
Thank you, Chris. And I'm going to emphasize a lot of what Chris just went through. I just say that, this is continues to be a very difficult situation for our farmers with these plants being down, and appreciate the partnership we have with Health and Department of Labor as we really try to keep our plants that are running and our plants that are down to be able to get them back in a timely manner. It's just an incredibly important issue. I also want to, highlight too that we had a plant in Windham, Prime Pork, that went down last week and is back up and running very well. I checked with them today, and so there's some good news in this too. And so as we continue to look at what we're doing as state agencies, is very important. As Department of Agriculture, we've been working on building out our capacity at our smaller meat processing plants across the state to help, but and to be able to handle as more livestock as possible. But there just simply will be too many animals, hogs and chickens to handle despite our efforts, and we will be needing to euthanize some animals. We're taking every step to not have that happen, but there will be that taking place. We'll be working with our American Veterinary Medical Association on the best practices for that as that moves forward. On the food supply issue, I just want to mention that for now our food supply is stable. Our consumers will see some disruptions as they have, and they may see some higher prices that it will become more pronounced if this, depending on how long this we're in this situation with COVID-19. And so I'll be glad to answer any questions. And at this time, I'd like to turn it over to Commissioner Lepnick.
Good afternoon, everyone. Thank you, Commissioner Peterson. So I would similarly reiterate that the Department of Labor and Industry continues to work with the Department of Agriculture and the Department of Health to engage with the meat packing and now also the food processing sector. Following on the engagement, the direct engagement we had at the beginning of last week with 50 of the meat packing facilities, contacting them directly, and then communicating with them about the guidelines that the department had developed along with Department of Ag and Department of Health, and also seeking their assistance and understanding the health status of the workers in their workplace. Greatly appreciate the facilities that identified challenges that they were having, engaged with one or more of the departments to obtain assistance, and all three departments are ready, willing, and able to provide that assistance. In particular, the Department of Labor has an OSHA consultation unit, which provides basically free consultation assistance to employers. We have stood up a team that is prepared to answer calls over the phone, but also to provide immediate assistance, but also is able to schedule on-site consultations with employers who are having more significant challenges in identifying strategies for standing up processes and conditions that are consistent with CDC guidelines. So we continue to hope that employers will seek our agency's assistance so that we can assist them in navigating these challenges and won't need to find themselves in a situation where they would have to close down their plant in order to make the next necessary changes. So again, the objective is to keep these businesses operating while fully understanding that there will be needed changes in how they operate their plants in order to address the requirements of CDC guidelines. So back to you, Michael.
Thank you, Commissioner Lepik, and thank you to all our commissioners for those updates. We would like to open it up for questions from reporters now. To ensure that as many as possible have the chance to ask a question, we'll ask that when you do ask your question, please limit yourself to one main question and one on-topic follow-up. With that, operator, I think we're ready to take questions.
At this time, as a reminder, if you would like to ask a question, please press star and the number 1 on your telephone keypad. To withdraw your question, please press the pound or the hash key. Please stand by while I compile the Q&A roster. Your first question comes from Jeremy Olson from Star Tribune. Please go ahead. Your line is open.
Yes, hi. First question is just have you investigated the transmission of the infection among these workers? Is it happening in the plant? Is it happening because by other means, they're just all getting sick because it's in the community? Just through any contact tracing or other means, what are you learning about how these workers are getting sick?
I think I can answer that if you like. This is EHRESMANN. I can tell you that we've seen, as I indicated, there's more than just what has happened or been happening with the plant in Worthington. We've also, seen symptomatic employees in other, agriculture production plants. And what we've seen is both the fact that, yes, we think that there is transmission that's happening within the plant, but we also know that there is transmission happening within the community. And so we have had situations in some settings where you have employees who are at multiple different locations within the facility. So it's not a situation where all the employees who work in a particular area have now tested positive, but you have employees from sort of remote places in the facility, which would suggest that we're seeing a combination of workplace exposure as well as community exposure. And we do know that, many individuals share contacts in the community in addition to their contacts at work.
And a follow-up, although it's a tortured connection at best, sorry, but I can help looking at the statewide traffic data and noticing if you take the last 3 Sundays, 2 Sundays ago we were at 68% below normal traffic volumes, last Sunday 39%, and then yesterday 28%. and of course our lakes and paths are filled with people. I'm just wondering if you're concerned about a weakening of our adherence to social distancing and whether that's a concern.
Yeah, this is Commissioner Malcolm. I'll take that one. And my apologies, I was on mute for the last question and didn't realize it. Thank you, Chris, for jumping in. Yes, I think that we are having conversations about that, and we certainly understand with the nice weather returning and people eager to get out and move around more. We know it's going to be a challenge, but in order for us to be able to make incremental progress forward toward the time when we can open up more businesses and open up more room for social interaction, that's going to be a process, as the governor, I think, pretty clearly explained last week. And our ability to keep moving forward is going to hinge significantly on people continuing to really keep the stay-at-home message in the forefront and to adopt those personal behaviors that we've talked so much about when we are out and about. And we've said it is great to get outside and get some fresh air, but we still need to be mindful of social distancing. And if you have to get out, stay close to home. Really, getting out should really be for those essential activities and for safe encounters, safe recreation near your home. So that was a good question, and I think you can expect to hear the governor talking more about the importance of those overarching stay-at-home guidelines as we continue to all be eager to get out and about more.
Thank you.
Your next question comes from the line of Theodore Keith, Box 9.
Hi, Commissioner, and all the others on the call. I'm wondering, and perhaps Chris, you have the numbers after the long weekend. I've forgotten the numbers of people who have died in long-term care facilities. So of the 286 total, what is the number that have died in long-term care facilities?
223.
Okay. And Commissioner Malcolm, you said last week that there was a CDC team in town that was talking with you and others as to what potentially to do in addition to the steps you've already taken at long-term care facilities. I'm wondering if there's been a resolution to that, and could it be that we see some of the healthy move into different facilities and some of the sick be moved into specialized facilities that take care of virus patients specifically?
Well, we have been encouraging cohorting of individuals who have been tested positive and who've had close contacts with those individuals. And we do think it would be a good strategy, and we're grateful for those facilities that have the capacity and the willingness to be a specialized resource for COVID support, as you said. So I think we can look forward to more of that in the future. Chris, I don't know if I have not seen any write-ups from the CDC teams yet. Chris, maybe you've been a part of some of those briefings, but we can certainly come back to that in tomorrow's call. If I do not have anything to report on that, but Chris, feel free to share if you do.
Well, I can say that the team is still here. They had originally intended to stay for 2 weeks, but they found that it was really a valuable time that they felt that we were gaining from their time here, and they were also learning from working with us and having a better understanding of what the issues were on the ground. So they are still here, and as the commissioner said, they will be providing us with guidance. I think one thing to just add to the comments that the commissioner made is that while we recommend cohorting of residents, so ill residents together, we want to acknowledge that moving residents to a different facility or moving them from within the facility that's their home and that they're familiar with, is a significant decision to make. And so, we first look at how we can best meet their needs within the residence that they're in. And so, want to be mindful of recognizing the impact and the stress that would have on people.
Thanks for that point, Chris. You're absolutely right. And I think my point about the COVID support sites, it really is more applicable to when somebody goes into the hospital and perhaps needs to come back, or where there's already some transition going on. But Chris's point is very well taken, that it's preferential to keep people where they are as long as they can be safely and well cared for there.
Thank you.
The next question comes from the line of Esme Murphy from WCCO TV.
Thank you, commissioners, and to all of you who are on the call today. My question specifically has to do with the deaths in Minnesota. If you look at the deaths in Minnesota compared to the number of cases, that ratio, it appears that Minnesota has the highest rate of death to case ratio in the entire country. I'm coming up with a ratio of 7.4 out of 100 cases here are deaths. If you compare that to Wisconsin, the number I got, 4.6, or you can just do the actual numbers, 5,687 cases in Minnesota, in Wisconsin, 266 deaths, 3,816 cases in Minnesota, 286 deaths. Why are we having so many deaths here? Even New York, their rate of deaths per case is better than ours.
Thanks, Esme. We've been interested in that question as well, and wondering what might account for the fact that perhaps a larger percentage of our cases are among long-term care residents. So I don't know, Chris, if you have any comments on that. For my part, I'd like to get back to you after we have the chance to dig into that a little bit more. But Chris may also already have some thoughts about that.
Well, Esme, it's a very good question. I think one thing that we want to acknowledge is that our testing in Minnesota, when we were at the point of limited testing resources, we were focusing on the highest risk populations. So all of our testing was being done, or a majority of it was being done in long-term care settings. And so our population was not representative of the broad population in Minnesota. We really were oversampling, if you will, in our long-term care settings, where we have the most vulnerable individuals and where we would expect to see the greatest number of deaths. I think that as the testing expands in the next, week or more, that what you will see is a bit of a leveling out of that number, because we will be testing in many other situations. We have the capacity now to test in many other situations where we're not so focused only on the highest risk. Obviously, we want to make sure that we're continuing to track what's happening in those settings, and we're going to continue to have testing there, but we're also going to continue to have testing in settings that are not so concentrated with the most vulnerable.
Well, I guess so you're saying it's not the case that COVID is more deadly here in Minnesota. And then I'd also like to ask about that figure, 223 out of 286 of the deaths in Minnesota have been in long-term care facilities. That's 77%.
Right, and so and that's why I just want to acknowledge that that's where we've been doing the bulk of our testing, is in those facilities. And so as we've expanded our testing, we should see some changes in those proportions. We'll need to continue to monitor it, but that, when you asked about that, that is an element to how we're getting data on cases that I think we need to be looking at right now as we evaluate those numbers.
And I think, Esme, to your question about whether the share of deaths coming from long-term care is higher in Minnesota than other states, I've just begun to see some reporting at that level from other states as well. So we'll have, I think, more. I think it's a very good question, and we'll have more insight into that in the near future.
Is the COVID
and I think
deadlier
partly
here?
It's also. I'm sorry. Go ahead, Esme.
So is the COVID deadlier here than it is in other states?
No, we certainly don't believe that's the case. We do think we've been actually very perhaps more successful than some states in preventing deaths among the general population. But it's a very fair question, and we will dig into it more to try to get you more apples-to-apples comparisons of our testing rates in certain subsets of the population and how these death rates compare.
Thank you.
But yeah, you bet.
And your next question comes from the line of Tim Nelson from NPR News.
Hi, thanks for taking my call. Is the Agriculture Commissioner still on the line?
I am.
Tom, are you?
Yeah, can you give us some more detail on how much meat processing capacity has been lost in Minnesota, and how many and what kind of animals you think are going to be euthanized, and what kind of impact folks might see at the grocery store?
Yeah, and thank you, Tim. So right now with Smithfield was obviously the first plant to go down, and in Sioux Falls, and that they took a large portion of Minnesota hogs at that plant, and then having the JBS plant down, is roughly maybe even more than 50% of our capacity in Minnesota, and so we are looking at somewhere finding homes for somewhere between 100,000 and 200,000 hogs a week right now and into the coming weeks. And so other plants are able to pick up, run Saturdays, and we're able to send some of them to smaller plants, like I say. But we will be, and we did euthanize some hogs last week. And so it's a very precarious situation. We've also have euthanized chickens. And you probably have read some of those stories and again, this also is not just plant shutdowns, but some of it is the eating habits of people during COVID-19 are changing. We're eating at home 80% of the time. Our packaging, our systems need to catch up, some too, as well. And so right now, it's really pigs, egg layers, and then with Jenny O down, in Wilmer, they are diverting chickens right now, or turkeys, to other plants. But hopefully that is a short-term piece. Farmers are also slowing down what they're feeding pigs, so they're not ready as fast. They're, lessening their diets, feeding them things that don't make them gain weight as fast. And they're also holding their hogs on farms longer too as well. So it's a tremendous impact. It's very difficult for our farmers, for our farm communities. The decision to euthanize animals is not done easily, and it's very emotional.
And can you talk a little bit? You said there may be some higher prices or some brief scares.
Yeah, no, and
like that.
Yep, and right now I think that we've been seeing this off and on, and again that gets back to my packaging, and as we're we have these the supply chain disruptions, and so I think there's product out there. We have a lot in storage too as well, and so I think people should have confidence that they're going to see, but there will be these disruptions at times, and there could possibly be higher prices for some of the things that they're seeing at the store as well. That could fluctuate quite a bit depending on how the plants come back online. And again, our goal is to get the plants back running and keep them running. So again, you will see disruptions, and you could see higher prices. Right now, though, things are stable because of what we have in storage.
Thank you.
And your next question comes from the line of Max Stepic from Minnesota Public Radio News.
Hi there, this is for Chris or for Commissioner Malcolm. Testing seems to not be at that 5,000 level a day mark that Governor Walz is wanting by the 4th of May. I know we've been well above 2,000 tests a day for, I think, since Thursday. Is the ramp up happening slower than expected, or is this about the pace that you had expected? What do we see this week in terms of testing numbers?
Yeah, this is Commissioner Malcolm. I would say, quite honestly, not unexpectedly, we're working through some logistical issues as we're trying to get all the systems collaborating together, and they are. And I think we're still working through some of those really kind of nitty-gritty operational issues about how we get supplies in the right places at the right time. And with some of what you've seen in the last couple of days is the weekend pattern of availability of sample collection for the most part. So I certainly expect those numbers are going to continue to climb during this week. We've asked the systems, the kind of that backbone that we described last week of Mayo and the university, kind of being the infrastructure that helps coordinate all of this. We're working together to try to set some more specific goals for increase, so we can give you a better answer of realistically what are we expecting by when. Certainly the governor was very clear about his hope and his goal that we would get to 5,000 by the 4th. So that's what we're working toward, but I certainly understand that there are logistics yet to be worked out. But I should have at least a better sense of what are our goals over time that I can share with you. I hope this soon this tomorrow.
And just to follow up on that, Commissioner, what's the biggest challenge you would say? You mentioned logistics in terms of reaching that 5,000 a day goal. What type of what are the problems that you're having now with logistics?
I think it's things like there's so many different testing platforms. So we've, I think, described that in the past, and Chris can help me here if I'm out beyond my knowledge, which is often the case when it comes to testing. But there's lots of different testing platforms, and matching up the specific supplies, even the specific type of swab or the type of reagent that's needed on this platform or that platform, and seeing if, because Mayo and the U have said part of their role in this integrated, coordinated system is to help get the supplies to the collection sites so that they are able to collect more, because we do have the back end capacity to process more. But it literally is what type of swab does this particular testing platform need, that we're kind of down to that level of figuring out where is the supply of that particular type of swab. It may not be the kind that Mayo has, for example. So part of the answer is building up the supply beyond what exists today by doing things like manufacturing, and that those discussions are underway. Not only with the U and Mayo. I think Mayo specifically has begun manufacturing some swabs, but they're manufacturing swabs with their testing platform. So working with other firms in Minnesota to also increase production of some of the other supplies that run on the other platforms. Sorry for that long answer.
No, that I appreciate that. Thank you.
Your next question comes from the line of Gabe Orrick from Pioneer Press.
Hi, thank you for taking my call. I'm sorry if you said this earlier, Chris, your connection was a little scratchy. How many total cases do we have for people who work in the food processing industry right now?
Actually, I didn't give that number, so I can tell you about a couple of different situations we're working on. I don't have a total for that at this point, but I can get that.
Okay, thanks. And as these plants are allowed to reopen, there's a little bit of confusion as you guys were talking about jurisdiction and hopes and guidance and stuff. Are all the workers that are going back to these plants, are they all now wearing PPE, and are all the plants that are operating following the distancing guidelines that they should?
Maybe I'd ask Commissioner Lepink if she wants to comment on some of the kind of the worker level guidance and processes that she's putting in place to advise on that. And then Chris, you can certainly chime in too. But Commissioner Lepink, you want to address that first?
Sure. So this is Nancy Lepink. So prior to that, but upon in the governor's very original executive order, critical businesses were advised that they needed to adhere to CDC guidelines and guidelines put out by the Minnesota Department of Health. So that has been the expectation all along with critical businesses. However, a little more than a week ago, when the Department of Health began to detect an increase in positives that were associated with meat packing facilities, the three departments came together and developed guidelines as to how those facilities could more effectively protect their workers from the transmission of the virus in their facilities. So those guidelines basically adhere and address the core principles of the CDC guidelines and how to social distancing, personal hygiene, disinfection and cleaning of plants, ensuring worker screening, and also ensuring that sick workers don't come to work. So the guidelines were developed to more specifically address what are some of the changes that might need to be made in facilities to better affect those core CDC principles. So it is our expectation now, and was actually from the beginning, but clearly since the guidelines have been put into place, that companies are reviewing their processes, reviewing their procedures, and basically making necessary changes in their operations, including provision of personal protective equipment where that's recommended or needed under the guidelines for them then to continue in their operations. So that is the expectation.
Sure, so that's the expectation. Are you guys verifying that that's in fact happening?
Well, we've been, all three agencies have been engaging with various facilities. Like I said at the beginning of the week, we were making direct contact, ensuring that they were aware of the guidelines that were issued. We've been offering assistance when requested to these facilities. And the department, we, unlike the Department of Health, Department of Labor is the regulating for workplace safety and health. So we are responding when, in particular, we receive complaints from workers regarding conditions in their workplace. We will respond with investigations.
So you're not doing regular site visits to ensure compliance then? None of the departments have the resources to do, routine site visits at these facilities. So we are addressing them, as I said, based on receipt of complaints, but also addressing them based on where we see potential spikes or incidents of workers testing positive. In particular, is the first priority. So, and that response can be an enforcement response. It can be an advisory response, either by the Department of Health or by Department of Ag or by local public health authorities. Okay, thanks.
Your next question comes from the line of Jeff Wagner with WCCO.
Thank you all for taking my call. Our question today we have is regarding to the contact tracing, especially with testing ramping up more than 2,000 per day over the past several days. We understand that kind of figuring out where these cases are coming from and how they're being transmitted is important. From what I understand, the state was looking to hire potentially hundreds of tracers. I just want to know how that process is going, how many people are doing it right now. Have we
I think we lost that question.
Yes, I'm sorry. And your next question comes from Greta Call from Minneapolis.
Hi, thanks for taking my question. I'm wondering, so if Minnesota ramps up to having 20,000 tests a day, how does this compare? I understand some of the supply chain issues are sort of being worked out. How does it compare to how other states are doing with ramping up supply? Do we have any sense of that?
Well, I think as you've heard the governor address, it literally is a shared problem across a lot of states. And I think, again, that we still would appreciate more support from the federal government on ramping up some of those supply chain issues in particular. But we've got the procurement team working that Governor Walz has described, and we've had Commissioner Alice Roberts-Davis on this call describing the fact that we're in that procurement team. They're now working on laboratory supplies as well to augment what the U and Mayo are able to provide through their own channels, and some of the various testing platforms that are being developed specifically to avoid some of the supplies that are the most constrained globally. So it's kind of a multi-directional issue. I think that a testing volume of 20,000 per day, which is our ultimate goal, or up to, I mean, as the governor has said, as we've all said, the goal is to test everyone that needs to be tested, but to do it in a smart and strategic way. That there is a lot of concern that there's much we don't know about the best way to apply tests and ways in which some types of testing, some points in time for testing actually don't yield meaningful information. So applying the testing in the best, most current evidence-based way is a big part of this strategy and a big value of working with the U and Mayo, who are kind of at the front edge of that research. So it's not so much about the number as it is about, are we able to meet our goals for testing all symptomatic people, testing all workers that are critical to the management of the disease, and being able to test more aggressively in hotspot areas, and to make sure that we're testing general population, as Chris said before, so that our numbers are reflective of the whole population and not just the high-risk parts of the population. So many different goals that all of that is kind of what led us to the estimate that we might need as many as 20,000 per day. That would put us on the high end of the range of what national sources are recommending in terms of testing volume needed to achieve clinical as well as surveillance kinds of goals. In terms of where we are against other states, there are various reports, various charts out there that show Minnesota's testing volume compared to others, and we're still sort of middle of the pack in terms of number of tests per 10,000 population or 100,000. I forget which the metric is, but I just want to reinforce, Chris made a really important point earlier, that our testing has been focused, we believe, more specifically and more narrowly at high-risk groups than perhaps in other states. So I don't know if I probably wandered off the point of your question there at some point, so let me know if I didn't answer what you were really after, and maybe Chris could also chime in. But did I answer your question, or do you want to reframe it?
That answered my question. Another quick follow-up. A couple weeks ago, during the webinar on the model, Stefan Gildmeister said that the MDH was estimating there were about 100 times more cases in Minnesota than we had confirmed positive tests. I'm wondering if there's any update on that number, just because of the exponential growth of the nature of exponential growth of a virus like this.
Yeah, that is right. That was sort of a pretty major statement from the modeling perspective that kind of confirmed something that Chris, I know, had been suggesting before. The model kind of seemed to confirm it, that it could be as much as 100 times, which, in a certain way, there's maybe a piece of somewhat good news in that, and that there is that higher level of disease burden in the community that isn't overwhelming the healthcare system. So I don't think that we have any particularly new data on whether the multiplier of 100 if we got any more precision around that than we did. But I don't know, Chris, are you seeing anything in the data that would lead you to say something different?
The only thing I'd add to what the commissioner has said is that part of the reason that we talked about multipliers is because we were recognizing and acknowledging that testing was not what we wanted and what we needed it to be. And so, as we get to the point where we're able to do more real-time testing of, all individuals who are symptomatic and need to be tested, obviously then we're going to have to reframe the projections, because no longer are we trying to figure out what does our testing represent. We hope that, as the commissioner and the governor have said, that we'll get to the point where we're testing everyone that needs to be tested, and then we won't have to do so much projection. So that's the only comment that I'd make, is that as we see more testing and more positives, we need to recognize that that does change how we look at the projections.
Thank you.
And you have a follow-up from Jeff Wagner with WCCO.
Sorry about what happened earlier. Don't know what occurred there. I think it's because I got a phone call right in the middle of asking my question. Was, again, talking about contact tracing. We understand the state was trying to hire several more people, and with testing going up to more than 2,000 per day and continuing to rise, how is the effort going in terms of adding more contact tracers? What's the number at? What's the goal in the coming days to reach? And I guess, what have we learned so far from this contact tracing about community spread? Is it happening more so in the workplace? Is it happening because people are going to a grocery store? Is there locations where it's standing out, where the community transmission is happening?
This is Commissioner Malcolm. I'll ask Chris certainly to chime in on that. But I think we're not yet doing, as we've just been talking about, we're not yet doing enough kind of population-wide testing to really have a really robust answer to your question on the nature of community spread. But certainly Chris's team that she leads at the State Health Department has added a significant number of case investigators and folks to help us do the contact tracing. So Chris has added a lot of capacity within MDH, and we're also working and beginning to sort of grow the workforce through working more closely with local public health partners, looking at where there may be graduate students from various disciplines in higher education that might be trained up for some of that kind of not the really high level epidemiology work, but the information gathering work of contact tracing. But Chris, why don't you add your perspective to where we are now and where we hope to get?
Sure. Yes, we have been adding new folks. I think, as you may have heard, that we have a hiring freeze within the state, and so our work is redeploying staff from other parts of the agency and potentially other parts of state government to assist with this, as well as engaging local public health partners. But I can tell you that just today we had a new cohort, if you will, of 20 contact tracers that we're starting. So we are continuing, and we will continue to add more and more people. So we're continuing to do that. And then to reiterate what the commissioner said, to comment on, where are people getting exposed, just to restate again that our testing up until this point has been very focused, either, congregate care settings, so residence, a nursing home, assisted living, those kinds of places, or we've done a lot of workplace testing, and so it's not really, as the commissioner said, a good representation of the entire population. So it's a bit premature to comment on what we're seeing because of that.
Operator, we have time for one more question.
Your next question comes from the line of Darwin Sevens from KTOE Radio.
Thank you. This question primarily would be for Tom. I guess that anyone else could probably chime in on this end of things. When it comes to the issue of processing plant availability, you mentioned the situation in Worthington. You've mentioned the situation in Smithfield in South Dakota. We've also seen a plant closure in Waterloo, Iowa. From trying to handle this situation, I know that the jurisdiction you have is here in the state of Minnesota, but knowing the fact that a lot of Minnesota hogs go to places outside of the state, is there a need to try to tackle this from a regional basis and not just a state basis in your mind?
Yeah, absolutely, and we're doing that. We're working closely with the USDA, and it's both back and forth. A lot of Iowa hogs come to Minnesota, and so it's really back and forth, and so it is really a coordination. We're in communication with our other partners in Iowa and other states, but also with the USDA. We're in contact with them several times a day and trying to work at this as a regional effort. We're working with our congressional delegation. Obviously, Colin Peterson is also very involved as Chairman Peterson. And so that's an excellent question, and it is going to take an effort on a regional scope.
And as for the Smithfield situation in particular, is there any signs that things are moving in the right direction regarding that plant, or is it still going to be a while yet?
And everything I've heard that it's still going to be some time before that plant is also back up online. And so we're just anticipating that, and as we prepare and try to deal with what we are handed today, that it'll be some time yet for both plants.
Thank you.
Thank you, Commissioners, and thank you for everyone for joining us on today's call. If you have additional questions based on this conversation or other topics, please feel free to reach out to the communications offices of the respective agencies. We will talk with you again tomorrow.
Find more local news stories at ccxmedia.org and follow us on social media.